So I might be aging myself, but in the last century, I was seeing a patient in my clinic who I was urging strongly to get colorectal cancer screening because he actually had a parent and a sibling who had been diagnosed at an early age. And he told me very frankly that he would be more than happy to undergo colonoscopy, but he couldn't because his insurance didn't cover it and he didn't have the money to pay out of pocket. I went to talk to my very close colleague, Michael Chernew, over a $5 bibimbap on South University of Michigan, complaining to him, saying that people say they have health insurance, but it really doesn't cover the things they need. And he had told me he'd been thinking about a concept called optimal health insurance, which actually would allow a better alignment of health insurance plans with clinical benefit. And we sat down and basically said, wouldn't it be a good idea to have a health plan that actually covered those things that make people healthy generously, as opposed to those things that are low cost generously. And we thought that there was enough money in the system and we could move the money around to allow more generous coverage for high value services and away from low value services, and thus the concept of value-based insurance design was born. So it's interesting that in the early days, in the first publication, the VBID concept was called the benefit-based copay. But because as we started to get traction and people started referring to us as the BBC, people reminded us that there was an organization across the Atlantic called the British Broadcast Corporation that wouldn't like us using their acronym, and thus we changed our name from BBC to Value-Based Insurance Design, or VBID.